Welcome to the Bodhi Academy. My name is Shrutika and today let us continue with the part 2 of our chapter Reproductive Health. So we were studying the contraceptive methods in the reproductive health. So today we will continue with the contraceptive method. First we have seen in the previous video we have seen the first contraceptive method, that is the natural method of contraception. Now today we are going to study the other methods of contraceptives, that is second one is the barrier method. So let us continue with the contraceptive methods. So in barrier methods, ovum and the sperms are prevented from physically meeting with the help of barriers. So in barrier method, basically the barriers are used to prevent the meeting of ovum and the sperm. So the first barrier method, the first type is the condom. So used by males, barrier made up of rubber or latex sheet used to cover the penis or the vagina and cervix of the female. It also prevents from STDs. So this is a barrier method. First is use of condom. Then comes the diaphragm. The cervical cap and valves are barrier made of rubber that is inserted into the female reproductive tract during coitus. So this is the condoms are used in males as a barrier method, and in diaphragm, cervical caps and valves are used in female as a barrier method. Then the third barrier method is spermicidal creams, jellies and foams are usually used along with these barriers to increase their contraceptive effects. So basically there are spermicidal creams, jellies which are used with the condom to increase the effect of the barrier method. So third type of barrier method is intrauterine devices. Basically they are used by the females. So the intrauterine devices are devices which are inserted by doctors or trained nurse into the female uterus through vagina. So basically IUCDs that are intrauterine devices may be non-medicated, that is lipase loop, copper releasing IUDs, that is CT, CU7, and the hormone releasing IUDs. So there are three types of IUDs. So the IUDs increase the phagocytosis of sperms in uterus, and copper reduces the motility and fertility capacity of the sperm. So copper releasing IUD, what happens is the copper which is released by these intrauterine devices will decrease the motility of the sperm. As copper has antibacterial property, it will identify the sperm as a bacteria or as pathogen which is coming into the uterus. So what it will do is it will act upon the sperm and it will decrease the motility of the sperm, wherein the fertility capacity of the sperm will also decrease. The hormone releasing IUDs make the uterus unstable for implantation and the cervix hostile to the sperm. It is ideal for female who wants to delay pregnancy and spacing between two children. Then the fourth type of contraceptive method is oral pills. They are progesterone or progesterone estrogen combination used by females in form of tablets. So they are basically hormones which are in form of tablets which are taken orally by females. They inhibit ovulation and implantation as well as change the quantity of cervical mucus to prevent retard sperm of entry of the sperm. Administration of progesterone or progesterone estrogen combination within 72 hours of coitus is found to be very effective as an emergency contraceptive. So basically they are hormonal pills which are used in the contraceptive method which are taken orally. Then comes the surgical methods. So surgical method is a permanent method of contraceptive. So this method is called as sterilization. It is used as terminal method of contraceptive in male and female to prevent any more pregnancy. So there are two methods of surgical. There are two surgical methods. That is, there is the surgical method in males and there are surgical methods in female. Okay. So this is the permanent method which cannot be reversed. So first type of surgical method is vasectomy. It is basically done in males. So vasectomy is the surgical method in males. A small part of the vas deferens is removed and tied up through a small incision on the scrotum to prevent release of the sperm. So this is called as vasectomy. So vas deferens is the connection between the testes and the penis. So from there only through the vas deferens the sperms are transferred to from the testes into the penis. So if the pipeline which connects these two parts is cut, then the release of sperm will be prevented. So this is how the vasectomy works. Then comes tubectomy. Tubectomy is basically done in female. So over here the fallopian tube which is there, it is cut and it is stitched with the it is stitched. So this will, what it will do is the release of the transfer of the egg from the ovary to the uterus will be prevented, hence there will be no fertilization. So this will be the permanent solution for as a contraceptive. So let us see how it is done. So vasectomy, this is the testes, this is the vas deferens. So vas deferens is cut and it is tied. So what will happen is when you cut and tie the vas deferens, the release of sperm and the transportation of the sperm into the penis will be prevented, hence preventing the fertilization and pregnancy. Then tubectomy, here this is the fallopian tube. The ovary releases the egg which travels to the fallopian tube and then comes into the uterus. In the tubectomy, what happens is they cut and tie the fallopian tube. So if the path of the egg is only cut and tied, then from where it will go into the uterus. So this is how the tubectomy works. So these are the two complete sterilization contraceptive method, that is surgical methods of contraceptive. So today what we have covered is the contraceptive methods, that is barrier method, then IUDs, then oral pills and the surgical methods. So thank you for watching today's video. Please don't forget to like, comment, share and subscribe to the Bodhi Academy.